Welcome to the Beyond the Vines podcast, where I interview local business owners in Sonoma County to highlight small business and grow our community. I'm your host, Amy Ehlers, a mom, realtor, and Sonoma County native, and I'm excited to connect you to some amazing people in this beautiful area that we call home. Welcome back to the Beyond the Vines podcast. Thank you again for listening. I am very excited to bring you a good friend of mine, Sandra Murray. She is the lead clinical coordinator at Raymond A. Ramos, DDS Pediatric Dentistry, located here in Petaluma. I have known her, I guess probably through my sister originally, but known her from taking my own kids there, and I had the pleasure of seeing her try to keep my screaming children calm when we met, and I am really excited to have her. Before we start chatting, I'd like to tell you a little bit more about her. Sandra is an RDA, registered dental assistant, and a CDA, which is a certified dental assistant on the national level. Prior to working in dentistry, Sandra graduated from St. Vincent's High School right here in Petaluma and went on to earn a bachelor's degree in social work from San Francisco State University. She specialized in advocacy, working in support services for children. Sandra grew up in Petaluma and currently lives in town with her husband and young daughter. 2024 marks her 8th year of working in pediatric dentistry, and she is, again, the lead clinical coordinator for Dr. Ramos right here in Petaluma. So welcome, Sandra.
Thank you.
I'm so excited to have you on.
Yeah, thanks for having me.
Yes, I feel like I haven't seen you in a minute, so it was so fun to catch up.
Same, absolutely.
For sure. Well, I would love to know more about your role as a lead clinical coordinator and kind of what drew you to specialize in pediatric dentistry.
Okay, so I wear a lot of hats at the office. Mm-hmm. My favorite hat is a chairside assistant. I love being chairside. I love working with the kids. But over the years, I've kind of parlayed it into doing social media and marketing, all the community engagement and education, outreach, and the intern coordinating and training, which is also super fun.
Wow, I didn't realize you did the intern training too. Your social media, by the way, is so good. It draws me in all the time.
Thank you.
Especially sometimes when you post pictures of my kids.
Yeah, thank you.
It's so good. And I will say too, having seen you like working chairside, you're magic. I know my kids are so good now, but they were very entertaining when they were very tiny coming in for their first appointment.
That's a nice way of putting it. They were entertaining.
I'm pretty sure like the very front lobby could hear them and didn't think they were as entertaining.
Well, you know what's funny is that a lot of people are always like, I'm so sorry. I'm so sorry. They were so loud. And we were like, really? It just doesn't faze us. Doesn't even phase us.
It's kind of like when I'm out to dinner with my husband and there's like a kid screaming in the next table and I'm like, I don't even know what you're talking about. Yeah. I can't hear them at all.
Exactly.
That's so funny. Well, that's amazing. Yeah. And your social media is so great. So speaking to like the screaming children again, I know a lot of kids experience anxiety and fear. You know, they're coming into this office for the first time. They've got someone they don't know's hands in their mouth. How do you and your team create that welcoming and comforting environment for them?
Absolutely. Dental anxiety is huge across the board. It's really prevalent in adults.
Yeah.
And it's also prevalent in children. We find that most kids that have dental anxiety coming in on first visits typically had a parent who had a bad experience as a child and
nervous.
Kind of have a negative outlook on dental care in a clinical setting.
Oh, interesting.
So we really try to make the office as fun and chill as possible. If you know Dr. Ray, he is from Southern California. He's like a surfer and a skateboarder, and he is super chill.
Super chill.
And that really translates to everybody. So, you know, we have games in the lobby. We have the movie bench. We have TVs in the ceiling with headphones to kind of help the kids relax. Pillows and blankets, you know, if they need a little bit of more comfort. We have the bubble wall, which is always
the bubble wall.
The bubble wall is the bomb.
Yeah,
Everybody
it entertains
loves the bubble
parents
wall.
as well.
For sure.
Like I could zone out and look at those bubbles forever.
Totally. It's just a nice environment. We try to keep it really bright and light so the kids feel comfortable.
Great. Yeah, I think you definitely have captured that like chill style there, which is so important.
We have to because our energy is going to translate to the child.
That's so interesting too, thinking about maybe parents who have had like a dental experience that they get nervous about passing that on to their kids, for sure.
Absolutely. We have parents that come in and at check-in say, oh my God, I'm so nervous. I hate the dentist. And I say, well, it's a good thing that you're not in the chair today.
Yes.
You know, like, let's just
let's not talk about that right now in front of them.
Yeah, absolutely. Like,
wow.
Yeah.
Go send them in front of the video games first.
yeah, absolutely. Yeah, absolutely.
That is so awesome. Also, the prize bucket is obviously like a fan fave.
Of course. I always tell the kids, like, when they're done, I'm like, you know, your mom doesn't get bubblegum toothpaste and doesn't get a prize. So we're going to keep you around as long as we can.
Good
and we do.
point. Yeah.
They stay a long time at our office.
Oh, yeah, they do. For sure. What's the oldest age you think you have?
We have some patients that have special needs that are in their late 20s, early 30s, that they have just built a really solid relationship with us, and we have a solid relationship with their parents and their care team. But we do have older kids, and the general rule is if their cleanings do not require more than a 30-minute appointment with an assistant, not a hygienist.
Right.
And they're covered under their parents' insurance and they're living locally, then they can come and stay, which is super fun because the chairs are little and they're really big.
Funny.
You know, they're
I think I would fit in one still, though.
I would too. I'm only like 5 feet, you know. But some of those kids, you know, we get a senior and they're 6'2" and they have a beard and you're just like, oh, what do I do with
just
this?
stare at the bubble wall, honey. That is too funny. Oh my gosh, that's so true. But it is, you've built this like very important relationship and this trusting relationship. It's hard to then leave and move on to a different dentist.
Absolutely.
So that's amazing. And it also speaks to what good work you do there, that people feel that comfortable. So amazing. So pediatric dentistry, I can't even say the word, pediatric dentistry often involves not just treating dental issues, but also educating children and parents about oral health. Can you share some of the insights into how you approach educating children and parents about their dental care?
Yes, it is really a foundation at the practice. You know, Dr. Ray is really concerned with the patients leaving and having the tools to carry on what they really need to know for the rest of their life.
Right.
So we really look at it like a collaborative effort. We need the parents as much as the parents need us. And we both need to work together to make sure that the child is successful.
Yep.
For sure. So we do that by trying to dismiss any feelings of shame or embarrassment on both ends.
Right.
The kids are embarrassed. The parents will be embarrassed. They'll feel shameful about their oral hygiene. And really, it's not a big deal when they're in the chair. If we focus on that, no one would ever come back. They'd never want to come back.
For sure.
So it's really important that the parents are on the same page as us and that the kids are on the same page as both of us together.
Great.
So that goes with a lot of chairside education and bringing the parent back and including them in the exam or in the cleaning and showing them under the dental light, this is what we're talking about.
Right.
This is what you can look for.
Yep.
And it really does help the kids be successful because let's be honest, they're little.
Yeah.
They're little.
Yeah.
Even, you know, when you're in 7th and 8th grade, you're still a kid.
This is very true.
You're still a kid. So having that guidance is really, really important.
That's great. That's really helpful. What are some common misconceptions that parents have about their children's dental health, and how do you dispel them?
One of the biggest ones that we hear, and it's typically with a patient that needs some restorative work. You know, they have cavities, they need fillings or extractions, and kind of the standard line is, well, they're just baby teeth, and they're just going to fall out anyway.
Right.
And guess what? That's true.
Yeah.
They are baby teeth and they are going to fall out. But while they are in your child's mouth, they serve a tremendous purpose. They help them with speech. They help them with chewing. They help hold a place for your adult dentition, so your grown-up teeth. So it is really important that we express to the parents that yes, this tooth may only be in their mouth for 5 or 6 years.
Right.
You're absolutely right. But underneath that tooth is a tooth that's going to be there forever. And we tell that to the kids.
Yes.
You know, when they start getting their adult dentition in and they're having struggles with brushing, we have to tell them, you know, that tooth has to last you until you're 100 years old.
Yeah.
Like
great
you
point.
have to take good care of it. So it is it's really important impressing that upon the parents that it's there for a reason, it serves a function, and yes, we will get through this awkward phase of wiggly teeth and losing them, but we need to keep them clean.
Yeah.
in the process.
I didn't even think about speech. That's a really good point.
Yeah, for sure.
Yes,
For sure.
Especially when they're learning at that age. And yeah, for sure. Is there any concerns too, like with gums or anything, if there's teeth with cavities baby teeth, if they leave them? Is there any concern with that or no?
Well, no, there is definitely concern. I mean, the bottom line is that when a child has extensive decay,
Right.
they are in pain.
Oh, good
And
point.
they may tell you it doesn't hurt. We hear that a lot. Well, they're not complaining about anything. Well, it's probably been like that for a long time.
Yeah, they're used to it.
And they're used to it. And they don't know that it's not supposed to feel that way. So gingival health is super important. You know, pediatric gums bleed just like adult gums bleed. It's the same tissue, right? So keeping up on the flossing and the water consumption and healthy snacks and avoiding gummies is super important to keep the whole oral environment healthy.
Right. I remember that when the kids were little, I can't remember. I didn't do like a normal gummy vitamin, but maybe it was like I don't remember. I guess it was a gummy vitamin, and doctor was like, no more of those.
Absolutely. And it's so hard. It's so hard as a parent because I've done a couple posts on Instagram in the past where I've gone into Sprouts and Whole Foods or Target and taken a look at the pediatric vitamin section, and 99% of them are gummies. And another myth that we have to dispel is parents will say, well, they're organic or they don't have, they're low sugar.
Yeah.
That's awesome.
They still stick to your teeth.
They still stick to your teeth. Yeah, they still stick to your teeth.
Yeah.
And then translating that concept of anything sticky.
Yeah.
You know, we see tons of, we call them the Costco dried mango cavities.
Yes.
Because you can buy like a 2-pound bag of dried mango.
My youngest could fly through a 2-pound bag of mangoes from
Absolutely.
Costco. Yes.
So
and
same
I did
consistency.
Have to, have her brushing her teeth after. It was like a whole thing. Yeah. Literally could fly through an entire bag of those.
The other kind of misconception that I think is really important, and we really stress this when I go out and do the school talks at the preschools and the kindergartens, is yes, children can brush their teeth. Parents will be so proud when they come in and they will say, oh, my 3-year-old loves to brush their teeth. They brush their teeth all by themselves.
Right.
That's awesome. Developing some autonomy in self-care at an early age is so beneficial.
Right.
However, they are not effectively brushing at that age. So that takes a lot of education also with the parent. You know, we tell them when your child is about 8 years old,
right,
and they have the manual dexterity to tie their shoe, then they most likely have the manual dexterity to effectively work the toothbrush over all the surfaces that need to be clean. And that is a big wow moment at the chair when parents will be like, wow, really? 8 years old? Yeah, 8. You need to be checking.
Yeah.
Because we still have baby teeth at 8 years old.
Definitely.
And we have a lot of eruptions happening, in those years. So keeping it clean is really important under a parent's supervision.
That's a really good point, especially because we're all so tired at the end of the night that we're like, but I do remember, I won't say which child because I would embarrass her, but one of them I literally had to lay down in the hallway and sit over and brush her teeth because she wasn't having it. And she wanted to do it herself, but she just, you go first and then I'll clean up after.
Absolutely. And and that's a great thing. And that especially with kindergartners, by the time you hit kindergarten, you have had to figure out how to use the potty all by yourself.
Good point.
You're probably picking out your own outfits if you're anything like my daughter.
I was gonna say,
right?
For sure in our house. I think I lost any say in that by TK.
Absolutely. So they want a lot of autonomy and they equate it with, but I'm a big girl now. I'm in kindergarten. I'm a big boy. This is things I can do. And kind of taking it out of the bathroom, as I say, if your family like mine hangs out in the kitchen, brush their teeth in the kitchen.
That's a great idea.
If dinner's over and they've, had their nighttime snack or dessert or whatever your routine is, brush their teeth in the kitchen.
That's a good idea. I've heard of the shower too. While
the shower's
you're showering,
great.
your kids can brush their teeth.
I always tell parents that are struggling, if they're still in a diaper, give them a toothbrush while you're changing their diaper. Let them sit there and relax and play with it and then get in. The ADA recommendation is 2 times a day for 2 minutes. If you could get in for 30 seconds over the course of the day a couple times,
that's a great idea.
That's great. That's going to get the job done.
Yep. That's a great idea. Oh, I love that. And also I think too, and we'll touch on this on my next question, but like I used to plan the Petaluma Mothers Club Fall Carnival. I know Dr. Ray always did that.
Always.
I feel like you were also good about educating people about how much sugar is in each of the things that our kids are consuming.
You remember
for that
that?
I totally remember that.
That was a great
I was
one.
like geeking out over that stuff.
Yeah, we did for several years. We did kind of like a sugar wall, and we had plastic bottles, you remember, and we had common things that kids eat.
Right.
And we would put how many teaspoons were in each serving. And the kids would look at it, or the parents would look at it, and we'd hold it up and say, would you have this whole bottle of sugar, just pour it down?
Back.
And they're like, oh no, that's disgusting. And I'm like, well, that's what's in the lemonade.
Yeah, that's how much there is.
That's how much there is.
Yeah.
And also showing that labels like organic and non-GMO and all of those things.
Right.
Sugar is sugar.
Yep.
So that's awesome that your juice box is organic.
Yep.
But it still has 14 grams of sugar in it. Let's dial it back a little bit.
Yes. I always have that conversation with my kids too, because they're like, but it's organic. I'm like, but it's still full of sugar. That's great. Yeah. Like, but when it's treat time, you can totally have that.
Yeah, and that's something really important, especially something that's evolved over the decades.
Yeah.
There used to be in dentistry, it used to be really like good foods and bad foods.
Right.
And now it's really important, especially when I go out and do the talks, to impress upon the kids that there are no bad foods.
Exactly.
All foods serve a purpose, right? And a lot of foods are nutritious and help you grow. And then some foods are just fun.
Yep.
And one thing that always gets them laughing is, I'll say, who likes donuts? And they'll all raise their hand. And who likes cookies? And they'll all raise their hand. And I'll say, guess what? The dentist says those are okay.
Totally.
You can have that stuff. Go for it. Enjoy it.
Yeah.
But make sure you brush your
teeth after.
Really, really well.
Yes. Yeah. I love that no bad food. We have in our house, we call it anytime foods and sometimes foods.
Yep,
like
absolutely.
You can have those anytime. And then that one, well, that's a sometime food. So when we, get to dessert, sure, if that's your choice,
Absolutely.
So
that's really great.
I love that. So let's talk a little bit more about the school outreach program. So those are a really effective way for you to promote dental health among children, among teachers, I assume too. It's important for them to hear this as well. Could you describe any initiatives or programs that you practice and involve schools and communities in?
Absolutely. So the practice started in Petaluma in 1976. So Dr. Steigner was the founding dentist. He was my dentist as a kid.
That's awesome.
There used to be a tiny little office behind Mervin's.
I
if
think
anybody
I remember
remembers
that.
Mervin's
Yes.
and where it was
Mervin's
on
was
Maria
the best.
Drive. Yeah. And he really started doing education out in the community way back then. And when Dr. Ray came to the practice in 1999, which this is his 25-year anniversary at the practice.
Wow.
He really made a point to continue it. So February is a big month for us. It's National Children's Dental Health Month. We schedule, starting in after Halloween, when the Petaluma Mothers Club Fall Carnival wraps up, I go right into school talk mode, because we've got to prepare. And we are so lucky in Petaluma to have so many programs from a preschool level, TK, kindergarten, that really value the importance of oral health and want us to come. And what's really interesting, in the years that I've been doing it, this was one of the first years that we got calls from principals or from kindergarten teachers that said, this is the worst oral hygiene that we've ever seen.
Why?
We need you to come out. And it comes a lot from, the kids that are in kindergarten now went through COVID.
Yes.
They're not COVID babies. They weren't born in COVID, but they were, 2 years old.
So they weren't
3
going
years
to
old.
the dentist.
They weren't going to the dentist for obvious reasons. And that has been really shocking. We've done some talks at schools that we normally don't go to. Where they're like, we really need some education and we need the kids to see that you are a person and Dr. Ray is a person and that we are there to help you. And there's a lot of stigma around that. So it's been super interesting this last month, especially getting those kind of calls.
Great.
But they're fun. The kids love them. We make them really interactive. It's really it's stressful. It's a stressful time for me, but it is also a super fun time.
I bet
it's
you see
super
the
fun.
Cutest kids.
They do. They're so funny. And they tell you the funniest things. I'll tell you when. This was the first time that this happened. I was at a local preschool And it was one of my first talks of like the season, the talk season. And we were talking about healthy snacks. So the talks focus on 4 ways to keep your mouth healthy, right? We're going to brush, we're going to floss, we're going to eat healthy snacks, and we're going to come to the dentist. So we get to the healthy snacks part. And I start talking about beverages, and I say, you know, things that you drink that are important. And, you know, we want to drink something that's so important and so accessible to us. And we're so lucky that it's so accessible. And it starts with a W. And then we tie it into how your lips and your teeth are helpful in your tongue for making sounds.
Right.
So I said, you know, wh, wh, wh. And I'm expecting the kids to say water.
Right.
And this little girl stood up and said wine.
Oh my gosh.
And I looked at the teacher. I looked at the teacher, and the teacher looked at me, and I thought, oh my God, I've never had that come up before, you know? And
that is hilarious.
It was so funny. It was so funny. And little things like that all the time.
That is so funny.
Yeah.
All those little like nuggets you can take back and tell your husband at the end of a very long day.
Oh, yeah. I mean, I'll like call the office in the car on the way home, and I'll be like,
funny.
oh my God, you guys, you will never guess what
we
this kid
post
said.
this on
Yeah,
social
this
media?
is so funny.
That is so awesome. Well, I think it's so great that you do that and that you do the outreach like that. And that is a really interesting perspective on dental health currently for that like TK Kinder age group, and another symptom of the pandemic essentially, and not being able to come in for
not being able to come in.
Dental care.
Absolutely. Yeah. And a lot of preschools used to brush the kids' teeth.
Oh, interesting.
You know, they would brush their teeth as a daily part of their daily routine. It went hand in hand with hand washing. And that obviously went out the door during COVID. And from what I've seen, hasn't come back.
Right.
So really when they're at home, that's the only time that they're getting their teeth brushed. And it used to be that the only time used to be maybe when they were at school.
Right. That's a very good point. Okay, that's a very good point. That reminds me when you say that, I used to like pick my kids up from school and take them home to brush their teeth before I'd bring them to your office because it's kind of on the way. But then we discovered one day in a hurry that you have toothbrushes that already have toothpaste essentially on them.
Amazing.
That you can use the sink. So now my kids don't want to stop at home first. They just want to go straight to your like sink and your toothbrush.
Well, you know what's so funny is
so
that
cool to them.
The assistants, including myself, we always really appreciate when the kids want to brush their teeth, right? Because I don't want to pick goldfish out of your teeth.
No,
I mean, even though if you work in dentistry, you kind of get a pleasure out of
Totally,
that. But I don't want to do it all the time, right?
Yeah.
So the kids will panic, like, I haven't brushed, I haven't brushed. And I tell them, you know, it's okay because I can tell if you haven't brushed for the last several weeks.
Right.
Or if you brushed your teeth really, really, really well, like last night and this morning. So
just had lunch.
Anything you do at the brushing station isn't going to make a difference, but it's still appreciated.
I mean, they like think that's the coolest thing, that toothbrush with the toothpaste already built in.
It. I know.
The other thing, too, and I'll just share this real quick, the 100% Brushing Club is like everything in our house. So making sure we meet that and getting that picture, but also looking at the wall of the other kids that have gotten it is so fun for them because they get to see photos of all their friends. Like, I didn't know she goes here, and I didn't know he goes here. And
it's really fun. It does become kind of a badge of honor. Yes. And over the years, we've added things to it. So we've had a lot of kids that get perfect brushing also have cavities.
Right.
But then there's a lot of kids that don't get perfect brushing. And what perfect brushing is in our office is that when you sit down prior to cleaning your teeth, we don't find any plaque on any surfaces of the teeth. Right. So in our opinion, we're like, wow, you really are being an effective brusher, a perfect brusher.
Yeah.
But I wanted to find a way to celebrate the kids that maybe missed a couple spots, but continually had clean visits with no cavities.
Right.
So we've got the cavity-free club, and the kids are like into that, you know, and they get a sticker and everything. And the assistants, we really try to make a big deal out of it. We'll get a chart of a patient who's 18 or 19 years old. And, you know, the chart's only like this thin. And I'll start flipping back through the pages, and I'll say, you have made it through your entire childhood without ever having a cavity.
That's crazy.
And that's so awesome, you know, and good for you. That's a big deal. You know, Dr. Ray really celebrates that for them. Cool. Like, that's amazing.
Yeah, that's amazing. Very cool. I love that. I love those little celebrations. So can you share a memorable success story other than the wine or rewarding moment from your experience in working in pediatric dentistry that really highlights the impact of early dental care?
Yes, I have a lot of stories, but I kind of got with the team before I came here, and I was like, what is something that like we all a situation that is really memorable and that really highlights the impact that pediatric dentistry can have on a child. And we have a patient who is a senior at Casa Grande, and she is lovely. She is so articulate and so poised and so driven, and she's really a pleasure to have when she comes in for her appointments. But she has not always been like that.
Oh, interesting.
She was a stinker, big time. And she was she had very poor co-op, and she was very loud, and she never wanted to sit down. And she is a patient that Dr. Ramos had already been at the practice when she started. So she always has only seen Dr. Ray. And he always used to say, oh my gosh, I remember her so vividly. Like she was a wild child, you know? But her parents and her older sisters continually brought her.
Nice.
Every 6 months. Every 6 months she was there, and every 6 months she was crazy. And then one time she came and she wasn't.
Wow. Yeah.
And she just kind of settled into it.
Yep.
And all these years later, you know, now she's a teenager and she comes in and she wanted to take advantage of our shadow program, which is something that we started a couple years ago. I found that going into the dental program without any experience in dentistry could be really scary.
Yeah.
I was fortunate enough to know some dentists in town that let me come and hang out with them before I decided to apply to the program. But not everybody has a connection like that.
Yep.
So we open it up for juniors, seniors, and recent grads.
Great.
It's very formal. I make them write a cover letter, and they need to explain why they're interested and what their future goals are. And they come in and they spend a whole day with us. They get full PPE. They go around from patient to patient. We introduce them to the patient.
I love this.
And this particular patient of ours did that.
Wow.
And she was great. I mean, she was so inquisitive and so smart, and we all just kept looking at her while she was looking at it going, oh my gosh, she's so amazing. And she's getting ready to graduate, and she's going on the track to go to medical school to be a pediatric dentist.
Wow.
And that is a story
Full
out of
circle.
100 kids,
Yes.
you know, that you get one of them.
Yes.
But what makes it so special is that she was such a stinker as a kid.
Yes.
And
That is
she
so cool.
built a trust with Dr. Ray, and then it just clicked one day and was like, this is really cool. I could really see myself doing this.
I love that.
So to us, that's a success story. We
that
love
is
her.
a huge
Yeah,
success story.
absolutely.
Does she know she was such a stinker when she was little?
Oh, totally.
Okay, good. So she's heard
totally.
the stories.
She heard the stories.
Does she remember?
We pulled out her chart. We showed her
did you show her all the notes?
You know, like poor co-op,
That is
and
so
you know,
funny.
like
Yeah.
maybe try this or maybe try that. You know, for the next assistant for the
to
next
help
visit.
out.
But she's really special, and that recently has been on everyone's mind.
Yeah.
So that's been awesome.
I love that you have that shadow program too, because I found by doing these podcasts, I've had multiple people who did go to dental school or they got their RDA. Am I saying that right?
Yeah.
And then realized once they were in it that it was not something that was right for them. And
Yes.
so I think that's so cool that you have this shadowing program so people can figure out what might work for them.
It's really important. When I went through the DA program at Santa Rosa Junior College, out of the students that were in my class, I think within the first year, a huge percentage of them didn't continue on with dentistry.
Right.
And I thought to myself, what a waste of time and money and resources.
Yes.
And why would you do that? And,
Right.
you know, you spent so much time and you worked so hard. And that is what kind of clicked with the shadow program. The office has had a long history of having people come in.
Right.
I really, over the last few years, wanted to make it more formal as I saw kids that didn't necessarily have the life skills that I was taught in high school about
Right.
communication and cover letters and presenting yourself and, you know, smiling with eye contact and handshakes
Shaking
and all of those
hands.
things.
Yes.
So I kind of just tweaked what we had always done.
That's awesome.
But you could get deep into your first semester, beginning of your second semester in a DA program and not look in a physical mouth.
Wow.
Because you're doing a lot of
You're doing
anatomy and
textbook.
morphology
Yep.
and all that kind of stuff. So we let them look in our mouth.
Mm-hmm.
As an employee, we'll lay
Yeah.
down in the chair, we'll
Good.
give them a mirror and explorer, and we'll say, look, is saliva
It may
okay
not
for
be
you?
their cup of tea.
It may
Yeah.
not be your cup of tea. You might look at it and be like, ugh, this
I don't
is
think I could
awful.
do it. I got to be honest. Maybe kids. I don't think I could do adults.
Well,
maybe
a
nobody.
mouth is a mouth.
Maybe nobody for me. This is why I'm in this office. That is amazing. Do you know Andrea Ivy? She's amazing. She was on this podcast a while ago.
From Recreation.
Yes. She goes into Casa and Petaluma and I think St. Vincent's and teaches similar skills because they are lacking for high school age. It's probably also from the pandemic as well, but they're missing that connection, communication, being professional, shaking hands, smiling, saying hello, that sort of thing. Yeah.
Well, when I was growing up, now I'm dating myself. We didn't have cell phones. We didn't have social media.
Yes.
We didn't have any of that. So the only way to make an impression other than what was written on your paper, which had to be grammatically incorrect,
Absolutely
or grammatically correct,
Absolutely.
and not have any spelling errors.
Yes.
And that
there was
your
no
first
AI
ticket.
to write it for you.
That was your ticket in the door. That if you did get in the door, you better bring it.
Exactly.
Yep. So the skills are still important.
So important. I love that you're sharing that. So important. The cell phone thing, that's a whole nother tangent for me, but I have big concerns.
I know.
From parent life, and you're right there. You're not there yet, but you will be shortly.
It's funny explaining to my daughter who's almost 6 that when I was younger, I couldn't call my nanny and FaceTime her.
Yes.
Like she can call my mom and FaceTime her.
Yep.
And that I didn't always have a phone in my pocket. And I had a phone that was attached to the wall.
Yes.
I mean, it like blows her
Mind-blowing.
mind. She's like, I don't understand. And I'm like, let me show you. Like
my youngest said to me, she goes, how did you send pictures to your friends back then? I'm like, well, we had these disposable cameras, and then we would take them to Longs, and then we would pay, and we'd wait a few days, and then they'd get developed, and half of them would be awful. But the ones that were good, if we really needed to send them to our friends, we would put them in an envelope and mail them. And she's like, that is awful. I was like, wow, you guys have it really easy just being able to text it. So funny. So coming off work a little bit, what are 3 fun facts about you personally?
Oh my gosh. Well, I only really thought of 2, but now I thought of a third one because I resisted technology for a really long time, which is so funny that I do social media for the office.
That is funny.
It was, I think we were pretty deep into 2008, 2009, 10 before I even got a cell phone.
Wow.
Because I was like, if you want to talk to me, you can find me at work or find me at home.
Yep.
I don't want to talk to you when I'm grocery shopping,
Totally.
And so people they always think that's so funny.
Yes.
They're like, for the person who really did
runs
not
social
want
media.
anything, it's funny what you do. Another fun fact is I was born without any wisdom teeth.
Wow, you lucky girl.
Yeah, so that is always fun to talk about.
Yes.
So when you are not born with a tooth that you normally would have, it's called congenitally missing.
Yeah.
So I was congenitally missing all 4 of my wisdom teeth. So that is kind of my mom's claim to fame that in 1977 she birthed evolution because we didn't need them, so my body didn't make them.
That is so true. She is very skilled to have pulled that off.
Yeah, she really
and
is.
also, that must have been thankful for you to not deal with, and also for her dental bill. That's great.
Absolutely. Yeah. I mean, nothing. Yeah. So
I wonder if your daughter will have wisdom teeth.
I'm curious. So typically we will take a panoramic x-ray around 8 years old.
Okay.
And then we'll take one a little later, earlier if they need orthodontic intervention. Right. But I am curious to see whether she has them or not. That would be interesting.
Keep me posted. I'm just curious.
Yeah.
It's genetic.
I will. Yeah. And the third thing is that Friday nights are pizza and dance party night in my house. So it's just my husband and my daughter who's almost 6. And we have a strobe light and we plug it in and we order pizza or do a frozen pizza.
So
and
fun.
I'm pretty proud that she has a vast knowledge of 80s music and 90s because I grew up in the 90s. Yes. I mean, she can pull off Ice Ice Baby like no one's business, and my heart just melts.
You're like, I'm doing this right. I am doing something right here. That is so awesome.
She
I
spins
love that tradition too.
Oh, for sure.
And she looks forward to that all week, I'm sure.
Oh, she does.
That is the highlight of the week.
She'll put a dress on and she spins like Stevie Nicks, and
That's
she,
adorable.
She ice babies.
That's amazing.
And that's fun.
That is amazing. I love that third fact. Also, getting a little bit off topic, but I did see your post. Did you treat all your was it staff or dental assistants to Hector's Pizza last week?
Oh,
or
yeah, on
something?
Monday.
Yeah. Oh,
so,
my gosh.
funny enough, this week is dental assistant appreciation week or recognition week.
Yes.
Today is actually also National Dentist Day, which I think is funny that they
Put 'em
get
all
in
on
on
the
our
same
week. I know.
Yeah, they need a different week.
So one thing that Dr. Ray has done for the last few years is instead of doing like a pizza party for the office,
Right.
we get to order pizza and a salad and it gets delivered to the
so
office
cool.
and we take it home to
I
eat with
love
our
that, to
families.
your
So
families.
we love Hector's. They're really
so
close
good.
to our office.
Yeah.
The pizzas are amazing. Their
Yeah.
customer service is amazing.
Yes.
So I was pretty stoked on Monday to walk out the door with a pizza and a salad and just put it on the counter and go to town. It was great. It was great.
That
yeah.
is so, I saw your post and it did have me craving Hector's too, by the way. But I love that you guys do that too and that you get to be a part of that. So.
Yeah, it's super fun.
That is amazing. So at the end of each episode, I like to ask if there's anyone you'd like to give a shout out to for your career.
Oh my gosh. So for my dental career, there's 3 people that have been like super integral in getting me where I am today. And one of them is, of course, Dr. Ray.
Right.
Dr. Ray is clinically an amazing dentist.
That's awesome
And
to learn
my
from.
chairside time with him when we are doing restorative work and he's showing me, when he's prepping a tooth and all of that stuff is just so amazing.
Yeah.
So him knowing that is really important to me and that I get really excited about it and taking the time to, tilt the mirror a little bit so I can see what he's doing really is what keeps me in the back. I mean, I could
awesome.
probably work for the office and not sit chairside and do all these
Totally.
other things, but I don't ever want to give that up.
That's so cool.
And then the other 2 both came out of Santa Rosa Junior College Dental Assisting Program. One of them was Shelly Smith.
Okay.
She is a local mom. She
Yes,
has twin
she's
girls.
wonderful.
She's amazing.
Yes.
Shelly was my student teacher
Oh,
in my dental
wow.
specialties class when I was a student. And then was the kind of the lead assistant at the first office I interned at.
Amazing.
And taught me a million things about being a chairside assistant. And I'm still friends with her today.
That is
awesome. She invites me. She's a full-time instructor at College of Marin in the dental
Cool.
assisting program. She invites me down every year to talk about pediatrics to the
Awesome.
students. She's been really influential. And then Jen
Great.
Poovey. Jen Poovey is the director of the dental assisting program
Oh, okay.
up at Santa Rosa Junior College. And my class was smaller and they were very young. And I was in my late 30s.
Right.
So I kind of formed more of a friendship with my
Right.
instructor at the time
Because
because
you can connect better.
I could have a better connection. She's amazing. She's done everything. She's been an assistant and a hygienist. She's got expanded functions. She's been a professor. She's amazing. And she really, really was the one that said, this could be so much more than a job.
Cool.
This can be your career.
Yeah.
And I don't get to see her as often as I used to, but she definitely had an impact.
That's amazing.
So the 3 of them are like my holy trinity.
That is it's so great that you've had such influential people, but also because you're doing so much community outreach, that could be you for somebody else. And the shadowing and don't forget that. You're going to be somebody's.
I would hope so. I would hope so because, it's important.
Yes.
You need your teeth.
That's so awesome.
You need your teeth.
Yeah, you really do.
And you need to be able to write a cover letter.
Yeah, and shake hands.
And make eye contact.
For sure. Awesome. Well, finally, where can my listeners find you and find the office?
Oh, awesome. Okay, so our office is on Cypress Drive in Petaluma. We are a few buildings down the street from the Kaiser facility.
Right.
3835 Cypress Drive.
Great.
We are upstairs. We are right next to our friendliest neighbor, Dr. Kirk, who's an orthodontist.
Shout out to Stephanie.
Shout out to Stephanie and Adrian.
I don't know
Dr.
Adrian,
Kirk.
but shout out to Adrian too and Dr.
They're
Kirk.
awesome. They're the best neighbors ever.
That's so cool.
We also have our website, which is petalumakidsdentist.com. You can get general information about the staff and the practice there. But really the best place to find out info is on Instagram.
Because you manage it.
Because I manage it and I answer all the DMs.
Yes.
And So it is at Petaluma Kids Dentist. When you pull it up, you'll see a picture on our profile page of Dr. Ramos.
Awesome.
And that is like where you can get tips and tricks and where we celebrate our patients and what we do and get a glimpse at the office if you're thinking about coming over.
That's a great idea to be able to go on and look at photos of it and everything. Also to show your kids before they're coming for their first visit too. That's kind of a great way to see how fun it is.
Absolutely.
And the energy and the vibe there.
Absolutely.
So, wonderful. Well, thank you so much
Thanks,
for coming
Amy.
on.
It was fun.
It was so good to see you again and to have you in here. So
Thank you.
Thank you. And thank you for listening.
If you like what you hear, please be sure to like and subscribe, learn more about Sonoma County and all that we have to offer here.